So I believe that those who join tonight is really either have really secure diet next year in March, or who are very, very interested to prepare this exam. So before we start, I will just have a very short briefing. So this is regarding the new format since recent diet until next year. So basically, we know that station 1 and station 4 will be a com skill station followed by a short case. So station 1 will be com skill. So you have 5 minutes outside to prepare. Then you will straight away go in and sit down on the chair, on the table, and then talk to the patient. There won't be any waiwa with the examiner. So the examiner will give you a hint that 2 minutes left. Only after that, you will straight away go to the the same station, which is usually very nearby the bed, and then you will perform the respiratory examination. So following after, you go to station 2, which is the clinical consultation scenario, and then station 3 is cardio neuro, and then you will come to station 4, which is also the same thing as a repetition, 5 minutes outside, and then 10 minutes for the whole communication skill, and then another 10 minutes is abdomen, and then after that you will go to station 5, which is another consult. So you will have two communication station instead of one in compared to old format. So this is actually quite important. I updated the passing mark for each component based on the recent diet. The only thing that changed is perhaps the concern for the passing mark. Initially, they give about 11 out of 16, but I think they actually reduce it to 10 out of 16 to actually make the passing rate more acceptable. But you can see that based on this, you know that com skill is something that is important because it only assess in terms of communication, only assessed by your clinical consult as well as ethical, uh, as well as your communication scenario. Let's say your consult, one of these scenario you didn't manage to score well and you only get like 0 or 1 marks. So that will pull you to a danger zone of failing. So that's why your com skill is the one that really as much as possible you must try to score perfection. And then a lot of things. Tonight's session is there's a total of 6 scenario, and basically all scenario is a common scenario. I didn't create like a very difficult scenario for everyone, but the idea is to practice and then to see how we can improve before the exam. So if possible, you should score full marks, and I hope for the best for everyone tonight who joined. So the first candidate is Dr. Ting. Dr. Ting, are you there? Can you unmute yourself?
Yes, yes, I'm here.
Okay, so I will give you, by right should be 5 minutes, but because of our environment at home is a bit controlled, I will give you 4 minutes to prepare the scenario, and then we will start after the 4 minutes. Is it okay?
Yeah, sure.
Okay, yeah. So I will start timer now. Okay, time's out. Dr. Ting, this is the patient, Miss Catherine. You can start now.
Hi. Can you hear me?
Yes, I can hear you.
Yeah. Okay. So, good evening. I'm Dr. Ting. May I confirm are you Mr. Catherine? Mrs. Catherine, 30 years old?
Yeah, I'm Catherine.
Okay. Nice to meet you. So,
Pleasant.
today we are here to discuss regarding your thyroid condition. Before I start, may I know how much do you know about your condition?
Yeah, doctor, I know that I have this uh overactive thyroid disease called Graves, and I was started on the medication, and then I have tried 18 months of medication. But when the doctor, when my GP actually tried to stop this medication, all the symptoms start to come back again, including tremor as well as the palpitation. So he told me that he have restarted this, and then he wants me to see this hormone doctor for further counseling and also the further step.
Okay. All right. So yes, you are right. So let me just give you a brief description about your disease. So basically, this is because of your overreactive of your thyroid gland, producing too much of a thyroid hormone that is causing the symptoms. So
Mm.
unfortunately, trial of medication in your condition has failed to control your symptoms. So, may I know, have you heard about radioiodine therapy?
No. What is this, doctor?
Okay, so I shall explain to you further regarding this therapy. So, usually, for this overreactive thyroid condition, we will give a trial of thyroid medication to bring down the thyroid hormone. So that is essentially what happened to you. But in certain cases, the trial of medication fail to control the symptoms. So what we'll do the next step is to refer the patient for a therapy called radioiodine therapy. So don't be bothered by the name now. So I shall explain the procedure for now.
Okay.
So it involves we give you some medication that is having a small amount of radiation. It's an iodine that contain a small amount of radiation. So what happens is that this medication will be absorbed by your thyroid gland. So this medication with the small amount of radiation, it will renders your thyroid function, the thyroid gland to be less active. Hence, by rendering the thyroid gland to be less active, we can reduce your thyroid hormone and hopefully to control the symptoms. Are you
Oh,
getting me?
doctor. Yeah, it sounds very dangerous. Is it a dangerous procedure?
Okay, it is actually a fairly safe procedure, but however, it also comes with a small amount of risk that I shall explain to you shortly. Okay,
Okay.
so there are a few risks when we giving you this radioiodine therapy. Before I tell you the risk, may I know, Miss Catherine, are you married?
I plan to get married soon, doctor.
I see. So you plan to getting married. I'm assuming you also plan to have children soon, right?
Yeah. I already plan
Okay,
end of early of next year.
okay. So is there any young children at your house at the moment?
No.
No. Okay. So as I mentioned just now, this radioiodine therapy involves a small amount of radiation. So um, this small amount of radiation, because of the small amount of radiation, we will need to put you on birth control or at least ask you to have a family planning for at least during the therapy session until the therapy session is complete.
Oh,
So
okay.
are you getting me?
Yeah. How about do I need to stop the medication I'm taking now?
Yeah. So before we subject you to the radioiodine therapy, you will need to stop your current thyroid medication maybe a 1 week before the therapy because this is for the therapy to be more effective. If you continue to take your current thyroid medication, this will render our radioiodine therapy to be less effective. Okay.
Oh, okay.
So another thing is that there is a small amount of patient when after the therapy session, the thyroid hormone will become too low. Okay, so when this happen, we will need to supplement you back with thyroid hormone. Okay,
Okay. Doctor,
okay. So
you mentioned that
yeah,
I cannot get pregnant if I go for this therapy. How long I need to wait, doctor?
ideally we'll ask you to have a family planning for at least 6 months.
Oh,
Yeah,
okay.
so refrain from getting pregnant for at least 6 months. So I will recommend you to update your doctor regarding your family plan and also practice barrier contraception for during the therapy session. Okay,
Okay. How
so
many
but
times I need this therapy, doctor?
okay, so some patients they will require a few sessions. So usually we can try up to 3 sessions, as most of the patient they will this therapy will be effective with 2 or 3 sessions. However, there are a small amount of patient, despite having 3 sessions of therapy, uh, the therapy will still fail to control the thyroid hormone. So if this happen, then we will need to discuss further other treatment options such as surgery or to continue on medication therapy. Yeah, so that we will discuss later if this therapy fail. But as of now, usually a patient will require 2 to 3 sessions to control the thyroid hormone. So what we'll do is that after the session, we will also continue to monitor your thyroid function closely to make sure the thyroid function is within our desired range. Uh, some patient they will be during the transient period after the radioiodine therapy, there will be a transient period that the thyroid hormone will increase drastically. So that is also one concern that we need to monitor. Okay,
Oh,
rest
okay.
assured we will monitor your thyroid function closely and do contact us if you experience any uh, high thyroid hormone symptoms such as palpitation, sweating, and
Doctor, do I
tremors.
need to get admitted for this procedure?
This procedure is done as a daycare procedure, so you don't need to be admitted. Okay, so you can come early morning to our radio nuclear department. So uh, they will serve you the medication. They will observe you for a few hours. If you remains okay after the few hours, then you can be discharged home. However, when you back home, we will need you to isolate yourself at home for at least 7 days. Okay, so please make sure that you do not share your bathroom uh, with other
2 minutes
people,
left?
or if you need to share bathroom with other people, do flush your toilet at least 2 to 3 times. Okay, do you have any other concern?
Yeah, doctor. Uh, I have been having blurring vision in the past 2 years. Will I have any risk of,
Okay,
worsening in terms
sorry
of my eye
to
symptom?
Yeah, sorry to hear that. So, because of your complaint of having this blurring of vision, we also refer you to our ophthalmologist, our eye doctor, to have a check on your eye to let them decide whether are you a suitable candidate to undergo this procedure? Because this radioiodine therapy also there is a small percentage it can worsen the eye symptom. Okay, so it is very important for us uh, to refer you to the eye doctor to clear this before we refer you to for this radioiodine therapy.
Okay, doctor. Then do you mean that I cannot do any outdoor activities or go to any public space?
It's just for a short period of time. So after the 7 days of isolation, then you are free to return to your daily activities like usual.
Okay, doctor.
Any other concern that you have? May I know what do you
Yeah,
working as?
yeah, I'm actually working as a promoter. If you mean that I need to isolate like that, then I cannot work.
Yeah, we will. If you are subject to this procedure, we will make sure to provide you a letter to your employer to explain clearly regarding your conditions so that you can be exempted from work. At least you can work from home for that particular period of time, that short period of time.
Okay, doctor.
Okay. Any other concern that I can help you?
No, no.
Okay. So, Mrs. Catherine. So,
Time's up.
after my
Okay,
ex,
thank you.
yeah.
Thank you, Dr.
Okay.
Ting. Okay, all right. So how do you comment about your performance?
Um, I think I probably use a bit too many jargon in the scenario.
What kind of jargon you use?
Probably like hormone,
Homo is not a jargon.
radiation.
Radiation is also not a jargon.
uh, I feel like I can make it more simpler for the patient to understand, but yeah,
Mm, mm. But I can see that your approach is a bit scattered. Don't you feel so? Don't you feel
yeah,
so?
yeah, yeah, I
Because
agree.
how you usually counsel for a procedure? What would be your kind of like a framework?
I will counsel the indication of the procedure,
Mm-hmm. You
and
give a
then I will
brief
counsel.
overview of the disease first, right? Like what you did
Yeah,
just
yeah,
now, and then
yeah.
you counsel on the indication why it must done because it's not responded to medical therapy, things like that. Then after that,
Then after that, I will tell the patient the concept of the procedure, just a rough concept of the procedure,
mm-hmm.
and the steps of the procedure.
Okay, concept
Uh,
basically brief overview of the procedure. Okay, after that,
yeah. Then after that, I will also inform the patient the risk and complication of the procedure.
mm-hmm. After that,
After that, at the end, I will try to get the decision from the patient whether patient
decision. That
agree or
means
not.
consent,
Yeah,
right?
yeah,
Yeah, you
correct.
didn't get consent from this
Yeah,
patient.
I didn't manage to get. I was going to ask whether do we have your consent to refer you, but yeah, tak sempat already.
No, because the moment I say no concern, you should the next question is to follow through is then are you agreeable for this procedure? You can take your time to think about it and we can always arrange a next session, to see by the eye doctor, see out their input and then we make a decision. You need to, follow up this kind of question without non-stop one. Okay? Cannot
Okay.
pause a bit. So this is something expected. And your social history, I got only one question to ask you. Is she a smoker?
Yeah, I think didn't ask regarding smoking.
What do you think is important in this scenario?
Yeah, yeah, it's important because it will worsen the condition.
What condition?
It will cause the what do we call that? Um, will it cause flare of the thyroid condition?
No, it doesn't cause the flare of the thyroid condition.
Less effective, is it?
Not really less effective.
I'm not very sure.
The highlight of this scenario is actually this blurring of vision.
Oh, okay.
So smoking can actually precipitate a grave ophthalmopathy, right?
Yeah, yeah, yeah.
So it actually predisposes the patient to have increased risk to develop. Okay. So yeah, other than that, I think you're quite okay, quite smooth. Just that you need to be a bit more proactive when you end the conversation. Don't like it like blank until time's up like that. You need to follow through the consent, and then after that patient say no more question and you got the consent on it just to address simply, then you will just tell, okay, so I will give you leaflet brochures, websites to know further details on the radioactive therapy and hospital contact as well if you are having any question or if you feel unwell after the procedure. Is it okay? Just like that. Just a very simple question to wrap up. You need to have a short sentence to wrap up if possible. Okay.
Okay. Right.
And the procedure, usually when you counsel on procedure, what we likes to do is actually you should counsel a brief because you say counsel briefing on the RAI, right? But how you're going to do that is that you don't know where to start. The idea is very simple. It's try to counsel during the procedure and post procedure. So this will be a very simple approach. So before the procedure, this is also another thing that you miss. You didn't mention that you need to withhold the medication until I ask, right?
Yeah, yeah, correct.
Other than withholding the anti-thyroid medication for 1 to 2 weeks, anything else that need to counsel?
Um, any drug allergies?
Okay, but not much of allergic per se, right? For I. Okay, then any other thing? How about diet?
Any stop eating like seafood? Uh,
Yes, correct. Stop eating
yeah.
seafood and anything that contains a lot of iodine.
Mm.
If patient are on amiodarone for like for example or AF or something, How long you need to withhold the medication?
I'm not sure how long should I withhold the medication.
It's longer lah, because amiodarone actually at least 3 to 4 months. So, but the scenario doesn't mention that, so it is okay. You don't have to take history to know about that, but you just need to mention briefly that some of the medication that contains they have risk to actually make this therapy less effective need to be stopped, and that also includes the diet lah. And then at this point of time, you can also counsel, do you smoke? It's also advisable to stop smoking at this point of time. And then the during the procedure, so yeah, I think you have saw RI being done before, right?
I have referred before lah, but saw it
Mm.
personally not yet.
Yeah, but I think you know somehow you know the procedure quite well, because not many people know that RI is actually a daycare form of procedure. Just go to the nuclear med. Basically, if you ask the patient, patient will say, swallow the radioactive water. It can be syrup or it can be capsule, depending on what the radio med give, the nuclear med give. So usually they just sit there and then isolate themselves 1 hour there and then check vital sign 1 or 2, then okay, then can go back already. So it's a very simple form of procedure. It is like not like what have to admit to the hospital and then to monitor and then isolate, then only discharge. Not really. So I think if I go to score you, actually you're okay. Com skill is fine, satisfactory. Concern is also okay. Judgment wise, I think you're probably I will give you borderline instead of perfect, because when you talk to the patient, you seem sometimes you seems a bit hesitant and then you takes a bit of time, but welfare is good. So generally, if you're going to score you out of 4 times 2 is 8 marks. So out of 8 marks, actually probably you will get able to x times 2 is 16 lah. So probably you will get about 14 out of 16, which is good. You did very well. So just a bit on the discussion lah. Yes, you are able to tell a bit on the grave disease, not the very heavy definition, but just to mention that the hormone. Actually, if you look at the NHS leaflet, they describe thyroxine as a hormone that acts as like a body clock to ensure our body is working properly. But if you don't want to use this term, it's also fine. There's a lot of this flexibility when how do we describe about this thyroid hormone. And then you can mention something like iodine is the normally found in our thyroid gland is get concentrated to make the hormone. However, this special form of iodine, be in a capsule or liquid, is actually part of it is radioactive. It gives off some rays, okay, beta or gamma rays. They have similar effect to X-ray, so that the patient will not feel a bit scared. When you talk about radiation, you talk about probably like nuclear kind of radiation. They are scared. So you need to tell them that it's actually like a similar effect to the X-rays to reduce the activity. And most of it actually goes to the gland. Some the remaining one will pass out in the urine during the first few days, and some can be present in the saliva or even sweats. And then before the procedure, this is the most important thing. Okay, thyroid hormone must be normal. As like this scenario outside is normal TFT, right? And then you should stop taking the anti-thyroid tablets immediately right before the patient kind of like ask you. You should tell them. And then you should also stop taking any form of vitamin supplement or mineral supplement containing iodine. That also includes some seafood, like you mentioned. And at least don't eat fish like or any seafood 1 week. And then she is female, so it's also important to make sure that we may need to check your urine to make sure that you are not pregnant because you are in the reproductive age group. Okay, and then at the same time, tell them to stop smoking if the patient smoke. And then during the procedure, okay, visit the hospital, swallow the pills, observe, and then after that, if no issue, can discharge. And then this is also another thing that is extra, in which I think is like a soft sign. Like if you don't have time, you don't have to go into too detail. But let's say the patient asks, then you actually should advise them not to take public transport because she contains radioactive. Because she won't know that the person close to her in public can be pregnant or even like kids they'll be around. Okay. So usually there's no side effect. Some may experience overactive syndrome like you mentioned, but generally it takes time and you need to take the medication. Usually we hold the anti-thyroid medication, but we continue the beta blocker for this reason. Okay. And we visit the doctor to decide if need to take any medication and check the bloods. Precaution, you mentioned a few. If the patient plan for breastfeeding or pregnancy, definitely cannot for 6 months and need contraception, like you say. And then men should avoid fathering child if this is a man patient for 4 months. And this is the important thing because if you look at the scenario outside, the caveat or kind of like the hidden agenda in this scenario is actually the blurring of vision. So you need to make sure that the patient grave ophthalmopathy did not get worse, or even you can ask to refer the eye doctor, it's not wrong. And then after the treatment, they need to observe, okay? And if they have any worsening symptom, anything, need to contact or come to hospital immediately. And the eye symptoms sometimes usually appear only after the eye when the thyroid hormone go into hypothyroid state. And this is also something additional. If the patient asks, if no ask, I don't think we need to mention because 8 minutes plus 2 minutes is very short. If patient wants to go to air travel, is there anything that need to be aware? So usually we need to provide some form of letter or cards to actually state that the patient underwent this therapy so that the security aware about that because it can be sensitive to some of the devices when they check the airport, when they go through the security check. And usually the follow-up is like 6 to 8 weeks, including to repeat the bloods and condition. And like I mentioned correctly, if it's underactive, then you may require some replacement pills. And then you should mention a bit of consent, social if got time, and then education. So that will be the complete kind of a scenario. But I think you did quite well. Just that I think still got some of things that you still can optimize further. Okay, you have any question? Anyone have question? No, huh?
I think
Yeah,
someone asked the amiodarone how long to withhold.
usually 3 to 4 months usually, if patient is on amiodarone.
Okay.
Oh, Ravinder asked this. So usually anti-thyroid hormone, it depends on the level and also depends on the condition. Usually we tend to withhold like 5 to 7 days if it's like 1 week. Some patient like very stable like that. Some may decide to withhold more than 1 week lah. But maximum is like 1 to 2 weeks, cannot be too long. Okay. Yeah, I think that's all. So we will proceed. Okay, thank you so much, Dr. Ting. I
Thank
think you are
you.
quite prepared. Just need to practice more. Oh, so
Okay,
next.
thank you.
Okay, thank you. Next is Dr. Kalai. Are you there? Can you unmute yourself?
Yeah, Doctor, I'm here.
Okay, all right. So you're ready for the scenario?
Yeah.
Okay, so again the same. I will give you 4 minutes for preparation,
Mm.
and then after that we will start straight. Your time start now. Okay, time's out. Dr. Kalai, are you ready?
Yeah.
Okay, so this is the patient, Miss Aini. Please start.
Okay. Hello. Good evening, Miss Aini. I'm Dr. Kalai here. I'm the doctor in charge of the ICU today. How
Okay.
are you doing, Miss Aini?
Not good, doctor. I'm worried about my father.
Yeah, I understand that, Miss Aini. Before I proceed further, will it be okay if I ask you how much do you understand about your father's condition?
Yeah, my father,
Hmm.
he admitted to the hospital after he got accident about 2 weeks ago. So I was told that he has suffered a bleeding into his brain, and the bleeding is quite massive until he require intubation, and therefore he's sent to ICU and have underwent the brain surgery. So after that, I don't know what happened in ICU, doctor.
Okay. So, Miss Aini, once he was sent to the ICU, as you said, he was having a bleed in the brain, and it was quite a massive one, and it required surgery. So, post surgery, he was pushed into the ICU, and he was in fact on a ventilator machine connected to him. Then, subsequently, during the process, he was in ICU. We tried to off the sedations. Sedations are the drugs we give during the procedures and to maintain your conscious level. And we try to off it and we see whether he regains any conscious level or not. But unfortunately, he did not regain any consciousness.
Oh, sorry, what this means, doctor?
Okay, so usually a patient who is have gone through this procedure, post that we will test whether the conscious level returns or not. This is a major surgery and it involves the brain, and as you know, but the brain controls a lot of physiological function involving the breathing, especially. So we would like to test if post of the sedation, we want to see if the conscious level is returned. That means he can do his breathing and he can control his body physiology on his own. Do you understand?
Okay.
Yeah. So unfortunately, in your father's case, this has not happened.
What it means, doctor?
Okay. So what it means that since the conscious level did not return, we get two of our consultants and we test your father's brainstem reflex. What does brainstem reflex mean? Is that it's the main area where which controls our breathing, our major activity in our body. So we try to get these consultants to test it, and once they test it and they confirm that unfortunately it's not working. Okay, so what it all means in a conclusion means is he's declared as brain dead, Miss Aini. I'm sorry to say.
Sorry, what you mean by brain death, doctor?
Okay, it means that clinically he's not there. What is attached to him and whatever ventilation we are giving him is only as a supportive measure, but actually he's not there, Miss Aini.
You mean my father has died?
Technically, yes, Miss Aini.
Oh no, doctor, how can this be,
Mm.
doctor?
Yeah, I know it's very hard for you, Miss Aini. I know it's not fair for you to go through this. I hope you have someone there for you to support during this moment, and we will be there for you to guide through.
Oh my God, doctor.
And
I
yeah,
cannot accept this, doctor. I cannot
okay.
accept this. Do
Hmm.
you really mean that he has passed away? Is it
Yes, Miss
possibility that
Aini.
possibility that you continue to put him on this breathing machine and he will miracle can happen and he will wake up one day?
I really understand where you're coming from, but unfortunately, Miss Aini, as I said, this was we've gone through this quite multiple times with consultants and the specialists around, and we have not seen a response from your father, and I don't think it will be right for us to be continuing with the current situation that he's in because it's more suffering for him and the family members as well.
Mm,
Yeah, I'm really sorry, Miss Aini. Do you need some time?
it's okay. Is there anything you want to talk to me about her
Okay, so
condition?
I know I don't think it's the right time to talk to you about this at this current moment, but I would like to just ask briefly, how is your father as a person?
Yeah, my father is very kind and generous man.
Okay, that's very good, Miss Aini. I would like to ask, did he ever mention about organ donation to you or any of your family members?
No, he didn't mention this before.
He didn't mention this before. Okay, okay. I believe you told me that he's a very generous person. So the reason I am talking to you today is I would like to bring up a topic called organ donation. I know it's very early for me to bring it up, but unfortunately, I have to tell you at this current moment because it's very crucial for us to do it as soon as possible to save the organs that are still viable. Is that okay, Miss Saini?
Oh my God. You just tell me my father passed away. Now you want us to donate his organ to other people?
Yeah, that's why I told you, Miss Saini. I know it's not the right timing. I get it. If you are very uncomfortable with what I'm going to say, I can have another session with you. But unfortunately, but I think it's very important for you to understand that uh, organ donation is something very noble act, and you just told me that your father is a very generous person, and there's a lot of patients who requires these organs that your father have, and it would be very much helpful if you can just bear with me a few moments so that I can explain to you what is this about.
Yeah, you can you explain first?
Okay, so Miss Aini, so what we're going to do is that this organ donation involves a special team of surgeons, and it will be done professionally. So the purpose of this organ donation is, as you know, it's to collect all the organs. The organs which we are collecting will be the main organs which is required for a human body to function. For example, lungs, heart, or kidney, depending. And we can also take the eyes if you want to. And then pre-procedurally, what we will do is we will make sure that the your father will be uh, well ventilated, and proper care as in to make sure the organs are vital will be make sure a continuous monitoring in the ICU will be done, and procedure will be done at it and in the operation theater once you have consent for it, once you have consented for it. So it will be done by a special surgery group involving multiple surgeons. Post procedure, we will make sure that your father will be returned to you in the original condition with proper care taken before giving it back to the family.
Oh, if I agree on this,
Yeah.
will this delay in terms of his burial?
Okay. Your The burial matter will not be delayed because it will be done after you have consented, and it will be done as soon as possible. We will have everyone arranged, everyone ready at the moment, and then we will go on to do the procedure.
Doctor, I have a few
Yeah.
more relatives is flying back from UK to see him last. We are very worried and they are really care about him as well. Can you delay all this first before we make a decision?
Okay, I understand where you're coming from. Can I know how long will it take to come to Malaysia?
Yeah, their flight is just going to be like 2 days in 2 days time.
In 2 days' time. Okay. Okay. I understand that, but Miss Aini, I just told you, right, because the organs are very, very vital and are very fragile. So let's say if you take more time, the it might have some damages to the organ, and we can't take it uh, to donate it to another patient. So there's a risk there, Miss Aini. But I really get where you're coming from. If you are okay, I can make a video call to them, and we will have a talk with them. And I will have my consultants and specialists there with me as well, so that they can explain in detail regarding it to you and your extended family as well. Is that okay?
Okay, but doctor, he
Mm,
never signed up for this organ donation before. Who are we
mm.
to actually give consent on behalf of him at his condition?
Okay, it's a very valid question you asked me, Miss Aini. So, in as I know, I think in Malaysia, if there's no organ donation card with the patient, the next of kin can actually give consent if the family agrees to it. And I think if the family is okay and the consultant who's treating the patient is okay, then we can proceed further. But regarding the further explanation, I will get back to you after I consult my consultant. Is that okay, Miss Aini?
Okay, doctor.
Okay. Do you have any other concerns that you want me to address, Miss
No,
Aini?
doctor. Okay, time's up. Thank you,
Okay.
Dr. Kalai.
Thank you.
Okay. Hi, Dr. Kalai. How
Yes, hi.
where where you register for your exam next year?
I think it's March.
Malaysia, right? It's a local,
Yeah.
right?
Yeah.
The reason I'm asking you this is because
Yeah.
it if this scenario come in Malaysia,
Mm.
the approach is a bit different as compared to in UK. You know what
Mm.
happened in UK since May 2020?
Nope.
Not sure, right? During the
Mm.
COVID period. So
Yeah.
if you happen to take, if anyone else happen to take this scenario in UK, you need to really know the policy of the transplant in UK, in which they change from opt-in policy to opt-out policy. What I mean by opt-out policy is that every citizen in UK is considered consented for transplant or organ donation until proven otherwise. Meaning to say, unless they opt out, then by default, just like Singapore, by default, if anyone pass away, the organ can be donated if it's fulfill the criteria. But in Malaysia, like what you did is correct, in which in Malaysia, regardless whether patient him or herself have consented before, has signed up for organ donation before, if the next of kin does not agree to the organ donation, then this procedure cannot be done. Okay, so this is based on the Malaysian transplant law, Human Tissue and Donor Act. I think it was very long time ago. I think the last time the updated was like 1990 somethings. So, but we still follow this rule. Okay, if you go to any mock exam, if you encounter this kind of scenario, it still follow the same thing in which we still require consent for the next of kin. But if you go to UK or you go to, for example, Singapore or some other country, you need to know that their country policy may be different in a way that, for example, in UK, our role is not to get consent for family members. Our role is to understand about the family members' idea, as well as to assist them in organ donation in a way that they can accept in terms of the culture and the belief and the patient own customs. But for Malaysia, basically we need to get consent from them. And based on your performance, how will you comment on it? Like, is there anything that you can improve it, or is there anything that you feel is good?
I think 10 minutes is a bit short for me to address about organ donation because she didn't know about her father, that the
Mm,
part where the off
mm,
sedation part, and that one she doesn't know that clinically he's dead. So I think the time is a bit short for me to
mm,
address, and
mm.
then should have given more time for her to vent out the
Yeah.
frustration.
So
Yeah.
one of the pitfalls I think
Mm.
in this scenario for you is that you need to break the bad news early.
Okay.
You cannot drag too long.
Mm.
For this kind of scenario, it's obvious that this is a breaking of bad news and counsel
Mm.
on the procedure, right? There's two
Mm.
components scenario.
Yeah.
Okay, so you need to make it short. Okay, you don't have to explain what is the brain testing done by two consultants. You can mention that, but you don't have to mention it in detail. You can just mention that yes, your father has been observed closely in the ICU, and despite 1 week without any medication to put him into sleep, it seems that he did not have any response. And unfortunately, I don't have any good news to tell you. You can straight away just keep a golden silence, and then you can tell the doctor that we have declared him to have a brain death. Just pause a while. So you need to break the news early, because in this scenario you are expected to have like 1 or 2 minutes wasted because to address the emotion by the next of kin. So this is something expected. So you really need to, you really need to budget your time. If this is scenario, you need to break the bad news early, and therefore you can tackle the emotion slowly. Like the patient or the patient next of kin, we're going to ask you again and again, doctor, is my father really die? How you are very sure on that? Things like that. Then you can mention about the remaining point, like, yes, my consultant have two of different consultants have performed the test and it was positive. Unfortunately, I'm really sorry to tell you. So you also need to keep on repeating that brain death equates actual death.
Clinical death. Yeah.
Death is an actual death. Okay.
Mm.
You use a bit of jargon. I can realize that you use like
Okay.
clinically. You use about sedation. You also use there's one more jargon that I cannot remember. But anyway, try not to use You notice that I didn't mention about anything about sedation. Right? I mentioned that medication to put him to sleep.
Sleep. Yeah.
Okay. So some of the some of the terms actually to us it's not really considered a jargon in the educated family members, but for examiner wise point of view, some of them may think that this is some form of jargon. You also mentioned about ventilated, keep the
Yeah,
father, right?
Yeah. Okay.
So ventilated is also not a good way to mention. Certain examiner can consider as jargon. Probably you can mention like I mean to keep the breathing tube there until things like that. Okay, so you try to avoid any controversial form of words. But
Okay.
otherwise, I think your performance is okay. Just that if let's say family members refuse organ donation, do you think you will pass?
They refused.
If
At the
they,
end of the session, I asked
yeah,
them and
after
then
you
they said
counsel
this.
Kao already, they still refuse. So do you think it will affect your performance?
I don't think so because it's their right to say
Yes,
no.
correct.
Right?
So also it's actually there's no right or wrong. Okay, the idea is to see how you counsel the next of kin and what are the words that you use. So the choice of words you use to counsel is important. And therefore you have to be a bit careful when you mention anything like, you know, especially try not to repeat the same words that you tend to use, because in this 10 minutes I can see that you repeated 4 times your favorite phrase. I can see where you're coming from.
Yeah.
You you recall that?
Yeah, I do.
Yeah, so because to us to become a bit more, sympathy and also empathy, you can use a word no wrong, not wrong at all. It's just that you need to be a bit flexible and a bit empathic in a way that I'm very sorry to hear that. You have to change your words a bit. You cannot be repeating the same thing again. Then sometimes it may irritate the examiner saying that, yeah, you understand where you come from, but you still push him. Some examiner will not give a good impression. So try not to use certain words like very oftenly. You still can use 1 or 2 times, but after that you have to change a bit lah. Okay. So I think if I'm going to mark you, it's okay. Most of it actually I think you can actually get a full marks for all. You can get 16 out of 16. It's just that like I mentioned, if you use jargon, then unfortunately the clinical communication skill you're only able to get borderline.
Borderline. Okay.
Yeah, because you use jargon. And some examiner, they just want to listen because they know that so many candidates are doing the same scenario again and again, right? Their ears are already very tired already. So they just catch whether you got speak any jargon or not. Let's say you accidentally speak one jargon, just one jargon, they just mark you unsatisfactory already because the criteria saying you use jargon. You see, this is not even an S, this is like a singular term, So once you use one jargon also, you can get unsatisfactory already. Okay, so that's why it's very important to know about this, to know about how they're going to mark us in terms of the exam scheme, so that you can get the maximum mark. Okay, but I will give you borderline if I'm the one that marks. It's just that sometimes you need a bit of practice, and yes, how to make it better in terms of explaining about brain death. You can mention that actually brain death is a form of irreversible damage to the brain center that control the breathing, heart, and also vital organ functioning, which is essential to survive. And brainstem death is actually equate a death of a person. You can pause and then you can repeat this a few times. Okay. And then yes, I think you mentioned about organ donation is a noble act, which is good. You use the word noble. You can also saying that it's an act of giving organ or tissue to help save and improve the lives of others, and regulated by the authority, tissue, things like that. And you can actually mention that actually organ donation, once a person actually can save 9 people's life with organ donation, be it any form of organ, including the eye. You don't have to mention all in total, but you can just mention that it's mentioned in the NHF leaflet, so it's not wrong to mention that. And then yes, you're good. Before you explore about the organ donation, you should explore the patient wish and what is his character in the past, and then also give some time for emotion. So I think that's all mainly. And anyone have any question for this scenario? Or Kalai, do you have any question?
Yes, I understand.
Yeah. So it actually goes back to the STEM. When you're outside preparing the scenario, look at the STEM. What the STEM tells you to do is actually to explain regarding the condition, which is the brainstem death, and explain the possibility of organ donation. So actually looking at this STEM per se, you know that your time is tight. So you need to budget your time. So you know that you need to give some time to break the bad news, and then to give some time to address emotion, and then following after you have to counsel a bit on the organ donation. Okay, I didn't become a difficult surrogate for you. Some surrogate can be like so difficult until you don't even have time to explain about the organ donation, and therefore you need to budget a bit and try to give yourself some time lah, huh? Especially focusing on the organ donation part. Okay, all right. So I think if that's the case, we will proceed to the next candidate. Tan, are you there? Tan
Hi,
Siok.
doctor, I'm here.
Hi. Okay. Are you ready for the next scenario?
Yes, doctor.
Okay, all right. So we will start. Let me check my timer. Okay, so we will start. We give you 4 minutes to prepare. Okay, time's up. Okay, yeah, Dr. Tan,
Sure.
this is Miss Sasha. You can start.
Sure. Hi, good evening. Is this Miss Sasha, 36 years old?
Yes, yes, I'm Sasha.
Hi, I'm Dr. Tan. I'm one of the doctor in this medical clinic. Today, I'm going to discuss with you regarding your health condition. Would that be okay?
Yes, yes.
Would you like to have any other family members to come together with you?
No, thank you.
Okay, all right. Um, Miss Sasha, can I first check with you? What have you understand so far?
Yeah, doctor, I've been having occasional tummy pain as well as loose stool for almost 8 months now. And I have done some investigation, including blood tests, and I was told that all this result is normal. However, I'm very worried. Today I supposed to come to clinic to see what you're going to tell me.
Sure, definitely. It must be a very not comfortable experience for you, as you mentioned that you have on and off tummy pain and then lose two for 8 months. Um, okay, I have all the results with me that you mentioned that you have did some blood tests. Yes, you are right. All your blitz results and the investigations that we have done, the result come back as normal. And also, I think from the previous clinic visit, some of the doctor have checked with you that you do not have any recorded very worrying signs. I just double check as well. Do you have like any severe weight loss, change in the bowel, change in your weight?
No, no, doctor.
No, like passing out blood.
No,
No, and then any family members with any like cancer or anything like that?
no, no,
No, yeah. So from the blood results and from the history and from the clinical sign, what we call it is a clinical signs that you mentioned, you do not have the worrying signs that suggestive that you might have some we call it a gut cancer or any worrying lesions there. So, we have discussed your case in details with our consultant. We have come to a diagnosis called irritable bowel syndrome.
okay. What
Do
is
you
this,
have,
doctor?
yeah,
I
do
don't know.
you do not know what is this? Um,
Mm.
I'm going to go through together with you, yeah? Would that be okay?
Sure, sure, doctor. I want to know.
Sure, sure. Basically, irritable bowel syndrome, we call it as we actually the exact mechanism and exact cause of this, the problems that you have, like tummy pain and then loose stool, actually unknown. Okay. However, a lot of patients who have the condition same like you, they experience the similar symptoms like you, tummy pain, and then loose stool. Some may even have some constipation. Okay, so what it means is this condition is basically some overactivity of the patient's gut. That's the reasons it causes a lot of spasm and a loss of secretion coming out from the gut. That's why that's causing all the symptoms that you have. Are you okay so far? Are you following so far?
Yeah, yeah.
Yeah, but overall, as the investigation comes back is normal, so uh, this condition is not to be a very the good thing about this condition is not to be a very worrying conditions that may cause some we call it a cancer or any big lesions that can grow into abnormal growth, which is a good thing. However, because of all the symptoms that you have, we are always here as a medical team to support you throughout this journey. Would that be okay?
Yeah, doctor, but I'm still very worried. I want to request for camera test, doctor.
Okay. Your concern is definitely valid. Okay. I will highlight your concern to my superiors, but usually we would not perform a camera test for the patients who have similar condition. Reason is because this condition usually is, we call it, it wouldn't cause any lesion in the gut. I mean, the abnormal growth lesion in the gut, and it doesn't need the camera test. But definitely, I will highlight your concern to my consultant and get back to you. Yeah. But for yeah.
Okay,
So
doctor.
So for now, we have discussed your case in details with our bosses, and then we have decided to start a medication for you to help you with your symptoms. Would that be okay?
What medication, doctor?
Okay. The medication's name is called amitriptyline. Have you heard of that?
Oh
Do you
no,
have
this
any idea?
medication. Yeah, I heard those patients with mental illness, they tend to take this medication. Do you mean they have mental problem now, doctor?
No, Miss Sasha. Yes, you are right that this medication is, we call it, some patients take it for mood stabilizer. You are absolutely right. But it doesn't mean that if you start this medication, you have a mental health problem. It's just that according to study and guidelines, this medication also help with the patient who have similar condition like you. Okay, and it helps to reduce the spasm, and then in the gut, that's why it can reduce the tummy pains that you are experiencing now.
Okay. What it does, doctor?
Basically, it slow down some spasm in your gut, so that with that, hopefully, it can reduce the tummy pains that you are experiencing now. I will provide some pamphlet and then some website to you so that you can read it through later as well. So before we start this medication, sorry, we have checked all your bloods. Result so far is normal. After start this medication, we are going to follow you up to see how your symptoms are, and then we are going to check your bloods as well so that it doesn't cause any side effects or any abnormality to your kidney or to your liver as well. We are going to monitor you closely. Yeah.
Doctor, what are the side effects for this medication?
Okay, some patients experience some kidney, uh, I mean, abnormality after the start, but we are going to monitor you closely. So please do not worry about that. We are always here to keep you in check. Okay?
Is it only kidney problem, doctor? Because I don't know. Is there any serious form of side effect I should be aware before I agree to this?
Sure. I would like to check with you as well. Do you have any like allergies to any medications previously, or any
No,
foods previously?
no.
No, okay. So
2 minutes left.
okay. So usually it won't, as you mentioned to me that you do not have any severe allergic reaction previously, but we are going to monitor you closely as well. Okay. But if you develop any discomfort after start this medication, please get back to us immediately. Okay. Do you have any other question that
Yeah,
you would
if I
like to
if I
ask?
if I don't want to try with this medication, is there any options?
Okay, of course, it's your right. We do not, you can choose not to start this medication, but we strongly advise you to, we encourage you to start, because it shows a lot of patients who took this medication show good response. We will, if you don't want to start this medication, we will advise you, we will support you through with give you some other medications. Hopefully it can reduce your symptoms as well. Basically this condition, we just support you through reduce all the symptoms that you have. If you have like loose stool, then we can give you the medication to reduce it. And if you have tummy pain, this is a good medication for that. Yeah. Do you have any other concerns?
No, doctor.
No. Okay. And also, some patients, we will ask, I will refer you to the nutritional and dietitian in our hospital so that they can advise you what certain foods that you can take so that it can help you better with your symptoms. I'm also going to provide you some pamphlets, some website and support group for this irritable bowel syndrome so that you
Time's up.
can know this condition better. Thank you so much.
Okay, time's up. Okay, Dr. Tan, how do you think about your performance?
Mm, I forgot what's the side effects for amitriptyline, so I think I didn't score well for that. Yeah,
Yeah, but amitriptyline doesn't cause AKI lah, huh?
sure,
Because
sure.
even in AKI patient or end stage patient, we don't usually adjust the dose.
Mm-hmm.
Another thing is that you did something that is very dangerous in this scenario.
Okay,
So you shouldn't actually ask about history at all. You can see that
I see.
the stamp already given you. There's no
No
red flag
red
to suggest more
flags. Yep,
malignancy, right? So
yep.
you are, because of this scenario already messy as such, you shouldn't take the history, because even if you are preparing any com skill scenario outside, there will be one sentence below: do not ask history from the patient. I didn't
I
include that
see.
because it is known to us that we shouldn't ask history.
Sure.
So this is the first point. Second point is that the drug allergy, the food allergy, I think that is fine. That is fine. It's not considered history at all. History that we cannot ask is something related to the chief complaint, which is part of the HOPI. Those
Okay.
history presenting complaint we shouldn't ask at all. Or else it's quite dangerous. Okay. Another thing is that you take very long to review the diagnosis of IBS. At 4 minutes only, you start to talk about patient having IBS. So it's a bit too long. You need to go
Okay.
straight to the point, because this is not like the old format that you got more time. This is a station that you are really in rush. At the same time, you need to be calm and cool and steady and slow, so-called slow and steady like that, in order to counsel most of the important point. So for this scenario, definitely you don't want to drag too long to get to inform the diagnosis and let the patient query a bit here and there. Only then you counsel further. So what is the how do you answer when the patient tell you that amitriptyline is also the medication to use in a patient with mental disorder? Other than telling you, other than admitting that this is a medication to treat for both condition, is there anything that makes a difference in between these two conditions for amitriptyline? Anything difference that we give?
Mm, I just know that like amitriptyline can serve such like antispasmodic. So I'm not too sure actually.
So actually, another thing you can convince the patient that no, this is not prescribed because you got a mental problem, is because
Okay,
the dose that we are going to start is a very low dose. It's not
I
like a
see.
not a normal dose that we give in a patient with mental disease. It's just going to be a very, very small dose, and then we will titrate slowly depending on your response. Okay. So this medication, this kind of scenario is very common. It can come out repeatedly, regardless old format or new format, because it's a medication that we should know about the side effect.
Yeah,
So
yeah.
if you remember the side effect, one of the things that we must do when we want to start this medication is we definitely need the ECG as a baseline. You know
Okay.
what's the reason?
Cause electrolyte imbalance, then AF, I suppose. I'm not sure. I really forgot the side
It
effect.
is the prolongation of the QT.
Okay.
QTC. So that's why you should tell the patient that we will do a baseline heart rhythm check, make sure you're okay, and then therefore in the counseling part also you must mention that certain patient, although it's rare, can develop a bit of chest discomfort or a bit of rhythm issue that we need to be aware. So if you feel uncomfortable, please come to hospital immediately. So all these things must be counseled. But is there any other side effect other than this so-called serious chest pain? Anything else that you know or you cannot remember?
I cannot remember.
So this medication is taken in the morning or at night?
At night, right, doctor?
Yeah, usually it's at night, right? Any reason we take at night for a medication other than statin that we usually take at night for different reason? But any medication that can cause sleepiness, we usually advise to take at night, right? So same reason for amitriptyline.
Okay.
Amitriptyline
Sure.
can cause a lot of sleepiness, and therefore it's also advised that if the patient feel a bit sleepy, shouldn't drive. Okay.
Yep.
Okay, so if I'm going to mark you,
Mhm.
in terms of your com skill is definitely okay, satisfactory. Concern, yes, I think you address most of the concern, but your clinical judgment because
Yeah,
you didn't talk about
MUGP.
the side effect,
Yeah,
and
sure.
therefore it's just get borderline. And then the welfare
Okay.
is yes, usually welfare everyone will get full marks. Okay, so usually how we define IBS, yes, you tell me that you first actually you must mention that this is a common disease. It's like a common disease, so that the patient will not get shocked. Oh, so what is IBS? Okay. Second thing is yes, what you mentioned is overactivity of the nerve or the muscle or the bowel, and the cause is we don't know entirely, and the symptom is as such. And the complication can be disabling in terms of the life, but no serious complication. Just mention in short, you don't have to, drag very long. And then the medication management can include medication and lifestyle. And the outlook actually is the same risk to develop any form of cancer, just like normal people. So meaning to say it actually does not endanger your life. And the precaution you should also mention, because we are confident that at this point of time, patient have no red flags, right? But that is
Mhm.
how indirectly you should mention about red flags. Instead of asking the patient, you should tell the patient, uh, yes, at the moment we don't think so. We think you have this. However, if in future you develop any blood stool, black stool, unintentional weight loss, we may need to do a further test. Okay, this is how you intelligently mention about the red flags. Because if you mention like that, if patient have got any symptom of that, definitely they'll mention to you, oh, doctor, actually I got this. Okay. If not, definitely they will not. Okay. So this is another reason that we can indirectly kind of like, mention about the red flags if you don't want to ask the patient, because we are not allowed to take history regarding the presenting complaint.
I see.
And the indication for scope, yes, you should mention that actually no benefit to gain from the test. How you actually going to convince is that it's actually not ethical for us to order any test that can do more harm than benefit, because every procedure carry risk as well as harm as well. Okay, this scenario is very very important. You need to explore about the social life. You didn't
I
mention
see.
anything about the
Yeah,
social
I
history.
didn't.
Because we
Mhm.
know that IBS can associate with some form of stressful activity, stressful life. So you need to explore whether patient got any stressor in the life. So if you ask me, I'm going to tell you that actually I'm very stressed with work. I actually also have issue with my boyfriend, and recently I didn't really able to concentrate at work. So all these things, is going to need to address. Okay, and examiner likes us when we ask this kind of social question. So always, if possible, we leave like about 30 seconds or even 1 minute to address this non scenario related kind of question to show that we are actually good in terms of our soft skill. So for management, aminotetylene, you can just mention that it's medication that can actually stabilize or reduce the activity. We usually start with very low dose and increase gradually, and then usually take it at the bedtime. Side effect is the one that you need to mention. It can cause headache, sleepiness, dizziness, and it can even cause dry mouth. So this is also need to. It's quite common actually to cause a dry mouth, and then usually the serious side effect is rare. That include blurring of vision, heart or rhythm issue, or in elderly it can may cause confusion, but not at her age lah. So no need to mention. And you should always highlight the fact that the benefit outweighs the side effect, and that is this medication is being taken not for intention to as a mood stabilizer or as an antidepressant. It's actually different uses with different doses. And you should also mention the precaution just now, like I mentioned, avoid driving if sleepy, develop any issue, burning a vision ke, chest pain ke, or any skipping or heartbeat, go to hospital. And then another thing, because she is in the reproductive age group, if let's say if you got time to explore, or if she asks, then you should tell. If you plan for any pregnancy, you should inform doctor, because amitriptyline is not proven safe in pregnancy. So by right need to bridge or need to stop the medication. And if you still got a remaining time, you need to definitely get the consent, or at least ask the patient, how do you think about taking this medication? Are you agreeable to this? You can take your time to think about it. So usually when we counsel about medication, if patient refuse, they will ask about alternative. So you always need to have a plan B in your mind. If patient ask me about alternative, what is the alternative? So not everything management is always about medication. You can always talk about non-pharmacal intervention. You talk about dietitian, which is good. And you could also talk about lifestyle modification. Okay, take regular meals, restrict legumes, tea or coffee, and increase high fiber diet, reduce in smoking or any stressful condition. So all this is like very common, very how should I put it? It's like a very common sense thing, but we will not mention during the exam because we are stressed and we just want to hit the main point in the exam. But bear in mind that when the surrogate or the scenario is conducted such a way, we need to kind of like give an idea that what else other than medication, what is your plan B? Okay. Another thing is that if the patient asks you that do you mean that I have mental disorder? Are you going to refer me to the psychiatric doctor? Your answer is definitely going to be no. So in overseas, we don't usually refer psychiatry for everyone. So even if this is like conversion disorder or anything, we can always refer to the psychologist first for psychotherapy, for counselor or so-called psychologist, okay, clinical psychologist or counselor for psychotherapy first or behavioral therapy. And if they think that need further assessment, then yes, you can refer to psychiatry. Unless in a scenario that like suicidal scenario, intentional self-harm, those definitely will need a psychiatry. And actually also need to mention a bit on the Mental Health Act. We won't be questioned on all these kind of principle, ethical, issue, but we need to mention in the scenario when we counsel the patient, we need to say that, let's say this patient is a like self-harm behavior, and then PCN injection or overdose or some form of drug overdose lah. So you can say, unfortunately, you cannot be discharged. Every cases like this, unfortunately, you need to refer to our psychiatry mental health team for further assessment. This is in accordance to our Mental Health Act. I'm sorry to tell you. Something like that, okay? But for this kind of scenario, you don't need to mention. And if patient asks also, you shouldn't mention. You need to refer to psychiatric doctor, just in case, okay? And yes, you can mention about education, leaflet, brochures, websites, about this medication, and hospital contact number as well, if unwell, things like that. Okay? Do you have any question?
No, for now. Thank you so much, doctor.
Yes, one of the friends asked about should we counsel a FODMAP diet? Yes, FODMAP diet is good for especially for functional GI disorder. So FODMAP, the problem with FODMAP is actually not sometimes the examiner is not gastro trained or already forgotten that or maybe not keep up to date regarding the management. So they may not understand what is FODMAP. So FODMAP is a form of diet that actually targets the medium chain fatty acid to reduce the irritation of the stomach. But the problem is, to me, this is a general exam. MRCP is still back to the basic of general exam. So if you want to counsel about FODMAP diet, it's a bit first two reasons I would advise against doing that. First reason is because of the time management. You only got 8 minutes. Plus the remaining 2 minutes to address the remaining concern and make a very short closure. Second issue is actually examiner may not know what is this. And third reason is actually because it will take time to counsel. It's not easy to tell about FODMAP diet. Okay. So I would generally advise my idea is very simple. My approach is also very straightforward. If you think that the patient need some form of dietary advice, you just mention like what Tan mentioned. I will also refer you to a dietitian to see how we can adjust your diet, just like that. You don't have to mention in detail. Sometimes like specific thing, because specific thing also come with specific instruction and knowledge that you need to convey. At the same time, the elaborator, which is the examiner, may not know well or well versed with this, so they may be like, okay, this is not important, and he's spending the time not necessary to counsel about that. So some people they may try to reprimand for this reason. So my approach is generally very simple. We just do what is mentioned in the STEM, which is explaining regarding diagnosis IBS and explaining regarding initiation of amitriptyline and answer the question. So this is my task. So I just go very simple and very straightforward. And then if got any issue, don't forget that in MRCP exam, we are expected to be like, we are the master of refertology. Okay. We will refer everyone. This is the best level. This is the ideal world that we should do whatever we can. We shouldn't, keep everything by ourselves. Manage this. I will counsel you on this. No. You don't have to do that. You just relieve the pressure. Just Tai Chi to everyone to give a multidisciplinary approach. That's all we need to know. Okay. So if no question, I will go through the fourth scenario. Fourth scenario, I will proceed with Wong. Wong Waiho, are you there?
Yes.
Yeah. Is it okay if I start with you?
Yeah.
Can, right? So, okay, I'll give you 4 minutes. Let me see my clock. Okay, so your time will start now. Okay, 4 minutes is up. Wong, before you proceed, I just want to talk about the format diet. So actually, to actually, some are not aware about this. So we are actually, if we really want to mention in like consultation scenario, we want to mention like, IBS, want to. So the idea is actually to avoid format diet. It's actually a low format diet. It's not to encourage format diet, because format diet is actually, those are the like fermentable products like oligo, disaccharide, all those, or even polyol, which is very hard to be digested. So those are going to cause a lot of osmotic shift, and then that is the one that can cause a lot of bloating and discomfort and irritable bowel syndrome. So we generally, if you want to mention like in the clinical consultation, you should mention advice for low format diet. Okay, so that will be the clarification. So Wong, are you ready?
Yes.
Okay, so this is Mr. Tom. You may start now.
Hi, good evening. I'm Dr. Wong, one of the doctors in the medical ward today. Can I confirm that I'm speaking to Mr. Tom, 35 years old?
Yeah, I'm Tom.
Yeah, just want to confirm that you are the son of Mr. Philip Fleschner.
Yeah, Philip is my father.
Hi, Mr. Tom. Nice to meet you today. So, Mr. Tom, before we start, can I know roughly how well do you understand about your father's condition?
Yeah, doctor. My father was admitted to the ward because of some infection in his valve. So he was treated with some antibiotic and then was observed over the weekend. And then, but today I noticed I got this news from from the nurses that in charge of my father that his kidney was injured. I really want to know what happened, doctor.
Yep. Yeah, Mr. Tom, what you understand is actually correct, that your father have a condition that require prolonged antibiotics treatment. And as what you understood, as per what the staff nurse have told you, that your father have a bit of impairment of his kidney based on the bloods that we have taken. So before that, I'm so sorry to tell you that because of that, one of the antibiotics called gentamicin, which is actually very effective in treating his underlying medical problem called infective endocarditis, which he has been already started on this treatment for a couple of days. And this is one of the drugs called as gentamicin antibiotics is known to be a culprit of causing kidney impairment.
Oh,
Right?
okay.
Yeah.
Is it commonly can cause kidney injury if you start on
Yeah.
this medication?
It is common to have kidney injury with gentamicin because for this, once we have started on these antibiotics, we will usually take some bloods to monitor the drug levels to make sure that patients doesn't goes into kidney injury. But in case they do, we can actually withhold the drugs and monitor it. So,
Oh, okay. But there must be some monitoring going on, or else.
Yeah.
But how can this still happen, doctor?
Yeah, unfortunately, that it was supposed one of the drugs that was supposed to be ordered on Friday, which is the level of drugs I've mentioned just now for this gentamicin, was actually missed on a Friday. And over the weekend, the gentamicin antibiotics, which I mentioned, which is a culprit to the kidney, has been continued for the past 2 days, not until today, which is Monday, that only it has been checked today. So it comes back to us that it's toxic, and that's why your fathers have a condition of kidney impairment. I'm so sorry for that, Mr. Tom.
Oh no, is this some form of negligence, doctor? I feel I want to sue hospital, lah.
Yeah, again, Mr. Tom, I'm so sorry that you feel that I don't think that this is negligence at the moment. But in case that you would like to sue before that, I would like you to accept our sincere apology and do let me explain to you further about this condition. Will it be okay for you?
Yeah, sure. But I really cannot understand how can this thing happen, doctor?
Yeah, so I'm afraid that at this juncture of time, I cannot pinpoint or tell what happened on the Friday and also through over the weekend, because whatever things that happened, unfortunately, has already happened. But moving forward, I think my focus now is actually on how to help your father at this juncture of time, because I think his health is my priority and his duty of care is entirely on my hand, and I have responsibility towards that. So, of course, I feel very sorry that this has happened. So for that, an incident report has already been raised so that we can actually get through what has actually happened over the weekend and also on the Friday on why the medication to check the toxic level has been missed. This is something that me and my team look very serious into it, Mr. Tom. Yeah. So
Okay.
we will definitely get this. Once we get this to the incident report and get to the mortality review, then we will And once we get the report, we will immediately update you if you would like to, Mr. Tom. How does that sound like to you?
Yeah, that will be fine. I'm glad that you are doing all this, but I just want to know are the potential harms to my father.
Yes, all right. So as I mentioned, moving forward, your father's care will be my top priority now because we need to reverse this condition. But okay, so we have already immediately withhold these gentamicin antibiotics. And at the same time, because there was a painkiller that was also prescribed concurrently over the weekend because of a back pain. And this is actually a culprit to the kidney as well. So I'm afraid that all this medication has already been withheld immediately upon knowing all this. And we are deeply regretted to inform you that despite having all this, we are very positively hoping that by withholding all these toxic agents, by monitoring your father bloods regularly for the next couple of days, we are hoping that by withholding all this medication and also putting him on hydration, the kidney can actually it takes time, but it will slowly improve. This is
No,
something that we should
doctor, but let's say his kidney get worse. If he require dialysis, will it be the point of it? Will his kidney go into failure?
All right. Of course, in medicine, there are a lot of possibilities, but based on what we see now, that it is kidney toxicity, as what we have discussed, is a possibility that he might end up in dialysis. But it is a quite premature for me to talk about dialysis. I'm afraid there will be too much information on you because I know you are very anxious about your father. But again, I wouldn't say it is not avoidable, but it is something that we should have consideration in mind. But at this juncture of time, it will be very premature for me to talk about dialysis and all. I think this will only incur unnecessary anxious and also worried on you and also on your father.
Yeah, doctor, I'm very
yeah.
worried, doctor. Is it really the kidney that we needs to be worried?
All right. So of course, as we talk about kidney worried, so may I know what's your biggest concern as you ask this question, Mr. Tom?
I don't know because first he coming because of the infection of the heart valve, in which he was started on these types of antibiotics, and now the antibiotic is causing complication. I'm very worried that this stopping on antibiotic can actually cause the infection of the heart valve become worse.
Okay, so of course, there are also side effects or reports saying that gentamicin can cause toxicity to the ears as well. So, I mean, hearing problem. Yeah. So, do your father experience that, or have you ever noticed your father experience that so far?
Oh no, I don't know. When I talk to my father, he seems still okay.
All right. So I think maybe in that sense, he looks quite okay. But in case you are worried, I can definitely refer to the necessary team. I mean, the doctors in charge of the ear to actually have a review on him to make sure he is okay. How does that sound like to you, Mr. Tom?
Yeah. But my concern now is if you're stopping the antibiotic just like that, I'm very worried that the infection of the heart valve will get worse, doctor.
All right. So for that, it was started because it is as per the infection of the valve protocol. So because this gentamicin have been stopped, we are still waiting for the formal blood culture. I think which is quite expected to be out by this couple of these working weekdays. So by stopping this, might not affect too much of the treatment regime, I would say. But this is something that I can ring up the microbiology team later to find out what is the positive cultures so that we can treat it according to what type of growth from the blood culture.
2 minutes left.
Yeah, so at the moment, this gentamicin has been started broadly without knowing what is actually the germs inside that's growing. So maybe by withholding a couple of days or maybe a few days while anticipating kidney recovery is not something that is worried at this moment. Do you understand me, Mr. Tom?
Yeah, I understand, doctor. But I'm still very unhappy. I want to complain. This is to me is not acceptable. How can I complain, doctor?
All right. So in case, Mr. Tom, that what I've explained to you, that in case you still insist on complaint, I can actually direct you to the hospital liaison committee towards the end of the conversation. So I give you all the details, necessary details, and also the steps on how to do it, and so that you can reflect these issues to the hospital committee liaison committee. How does that sound like to you, Mr. Tom?
Yeah. That
All right.
sounds okay for me.
Okay. All right. So moving forward, do you have any questions or concerns for me?
No.
All right. So, Mr. Tom, again, me and my team and I deeply apologize and regretted that this has happened. But again, rather than dwelling into all these mistakes or this blood taking, I think moving forward, your father's health is my top priority now. And in case you really like for the complaint, I will definitely guide you. But for now, the top priority is to make sure your father is safe and also make sure his kidney is in good hands. So I hope you can understand, and I will definitely arrange the what you call it. I mean, I will arrange. I will also reflect it to my consultant and also arrange the necessary steps for you on how can you get to the hospital liaison complaint committee. This sounds okay for you.
Yeah, okay.
Okay. Do you have any more questions for me?
No,
Have any more time?
5 seconds.
5 seconds. Oh, I'll stop it.
Okay, all right. So that's all. So, Dr. Wong, how do you think about your performance?
Don't know. I'm not sure.
So when the surrogate asks you that, is this a negligence? You say not, this is not a negligence. So what is this?
Error.
Yeah, this is a medical error, right?
Yeah.
But you didn't tell the patient that this is a medical error. What you say is like, things already happened, so let's move forward. This is how you answer that, and answer the surrogate in short, in brief. So perhaps you should mention that this is an error. Unfortunately, this has happened, and we need to look into how this thing had happened. Okay, so it's not just to jump to conclusion straight away that okay, we shouldn't delve into the things that have already happened. We should move forward, because when you purposely mention like that, it seems like very forcefully you don't want the surrogate to keep on asking about that.
Yeah. All right.
Okay. So another thing is that my question to you is, how do you find about this scenario? Do you feel a lot of resistance in counseling in terms of the complaint?
In terms of a complaint,
Like let's say the surrogate keep on want to complain, right?
Mm.
Do you feel a lot of resistance and a lot of difficulty to proceed?
yeah, a bit. Yeah.
A bit resistant, right?
Yeah.
So another thing is perhaps to do it better, since you got a bit more time. Actually, you should need to counsel. You need to ask about the patient a bit on the social aspect. Regarding how is Mr. Philip in the past, how is he? Are you staying with him? To really kind of like break the very strict atmosphere, because the only way we show our care, other than keep on mentioning that his health is our top priority, we always will give the best, blah, blah, blah. But eventually what actually for examiner point of view, how we actually care about the patient is actually asking a bit on the social aspect. Okay, so because we know that this is like infection of the heart valve, this IE definitely needs prolonged antibiotic and may need a so-called PICC or anything lah. So it's allowing the long hospitalization. So we need to explore the patient dynamics in terms of the support. Okay, first is in terms of the financial, second is in terms of the social support. Is there any issue in the family, things like that? So I know this is a bit, to some this may seem a bit over, in the sense that we don't have much time to do all this. We already stuck here and there, but this is the one, really the one that will actually immerse yourself as someone who really cares about the patient. Other than we keep on saying we will give our best, we will do our best. So it is not enough when we mention that we should explore that what is the thing that patient really matters. Okay, so I think it's in terms of breaking this scenario as the medical error, I think you're okay. Yeah, there's some dog, I think. So in terms of breaking this complaint, I think you're handling the complaint, I think it's fine. It's just that your approach, I can see that you're quite fluent. It's just that sometimes you need to pause a bit. You are going a bit too fast in this scenario. This scenario is a scenario that you need to show that you are very concerned, but at the same time you don't want to be speaking too harsh and also too fast. You need to keep yourself calm and professional. Say that I'm very sorry that yes, what you did was to apologize initially, and then you talk about escalate this issue to your consultant, is make an incident reporting and investigate how does this thing happen. And you also need to, at this point of time, stress on the fact that why we need to do this is actually to improve our service, our hospital service, and prevent this thing from happening again. So you need to highlight the fact that why we need to do this, because to certain patient relative, this may be unnecessary. This is just your own, auditing, nothing related to us. But they need to realize that this thing can actually potentially improve the services and actually prevent the same thing from happening to the same patient or even to other patient. So they will see the rationale on doing this. Okay. Other than that, in terms of the management, you mentioned you have stopped the celecoxib, you have stopped the gentamicin, and then you mentioned about the hydration. You also need to mention about the monitoring the kidney, in which you did, and then ask about the dialysis part, in which you mentioned is a bit premature. But perhaps a better way of saying that is always, you mentioned that, yes, if unfortunately, if his kidney function continue to deteriorate, he may require a temporary dialysis. However, please rest be assured that we will try our best to support his kidney and hope that he can recover and will not require this form of therapy. Instead of saying that this is a bit premature to talk about all this, I think it's a bit overstressed. You need to focus on this. Your consultation, if you go towards this kind of direction, some examiner may feel that you're a bit harsh. Okay, so it's always good to take note of what patient mentioned, and then you just return it like smoothly and also a bit gentle. Okay, otherwise I think you're okay. Com skill, I think you're fine, no problem. Concern, you address most of the concern well. Clinical judgment, I think you're okay. Actually, you can get full mark in this scenario. It's just that I still feel that you're a bit harsh. So you need to tune down a bit and you need to speak a bit soft. Okay. And basically, this is a scenario of incident reporting and medical error, right? So I always have this mnemonic when I encounter this sort of scenario to make sure that I have my framework or my backbone of this scenario, so that I won't actually go far beyond. So I will first admit that this is a medical error, and I will apologize as a team. And then I will explain, you haven't explained that this error is not intentional, right? You didn't explain, you should always say history report and everything else. So you need to explain that this error, unfortunately, is not intentional, okay? It can happen to anyone. Unfortunately, it happened to your father. And for this reason, I will do all the I's, incident report, inform consultant, and investigate how it happened and to prevent it from happening. And you may need to repeat the apology a few times. And then following after, you need to mention about the autonomy as well. Because at this point in time, definitely next of kin will want to complain and express their unhappiness. So you can mention that you have right to complain. You will provide the best care. This part, I think you did very well. And your reaction. So your reaction is to stop the medication and then repeat assessment. And in terms of the antibiotic, you can see that there's a reason why I asked 2 times. First is, yes, this is an empirical antibiotic, correct? And you're still waiting for a formal culture, which hopefully out within days, next few days. But this time, if you think that the medication it may not be adequate in which the family members concerned, you can always mention that I can also involve the infectious disease team to actually consult whether any role of any other alternative antibiotics for the moment. Okay, you can always mention that always offer a bit of alternative instead of being very restrictive. And then yes, you can also consider refer to the kidney doctor if the kidney actually get worse, okay, and may require temporary dialysis. And if I didn't prompt you, I'm really worried that you didn't mention anything about hearing assessment, EMT, and the ototoxicity, because when I keep silent and I try not to ask this question, I realize that you are not going to there yet. And I don't know whether you're going to counsel me on that, because this scenario, one of the hidden agenda perhaps for gentamicin overdose or toxicity is always to counsel about the risk of hearing loss. It can be permanent. Sometimes it can be permanent. That's why it's important for us to counsel. I know that this is not mentioned in the scenario, but sometimes certain scenarios have certain hidden agenda that we need to fulfill. Okay, so that's why this is of such a scenario that you need to mention. You can just mention like 1 or 2 sentences. No need to focus on that as a point of discussion. You can just mention that occasionally there's also other side effect that can occur in this condition. Sometimes a person can have a bit of hearing loss because of this overdose of this medication. For that reason, I also need to refer to ENT doctor to have a check on her on his ears and also the hearing. And you will need to be assured again that the complaint will not affect the management. If let's say the next of kin decided to complain. And then yes, you can see that social issue is important. That's why I also insisted to put on this before you even ask about the concern, because most of the concern, the surrogate usually will try to ask as much as they can within the time. So, but perhaps how you're going to be different from others and how the examiner going to look at you differently and think that you are a caring physician is when we ask about social history. So keep some time for social history. Only then you summarize, you give brochures, leaflet, hospital number, things like that for any further question. Okay. All right. Is there any other question? Wong, you have any question?
No, thank you.
Okay, yeah. All right. So I think that's all for Wong. Next, I will go to Ai Nin Tu. Are you there?
Yeah. Yes, I'm here.
Hi, you are from Myanmar, is it?
Yes, correct.
Okay. Are you taking the next diet soon?
Yes, a diet one in India.
India. Oh, you
Yes.
got the diet one in India.
Yeah.
India scenario can be a bit unpredictable sometimes, but generally for communication station is always prepared by RCP. So there will not be any, things that is out of norm. But you need to be aware that the consultation scenario as well as the short cases can be a bit tricky at times. Okay. So you are ready for this communication scenario?
Yeah.
So I will give you 4 minutes for preparation. I know that in actual exam is 5 minutes, but because we are all very comfortable sitting on the table without the exam mode, so this is just to speed out yourself so that you can prepare well in the real exam. So we will start the timer now.
Yes.
4 minutes, yeah. Okay, 4 minutes is up. Dr. I,
Yes, yes,
you can start now. This is Madam Asma.
yes. Hello, I am Dr. Tu, one of the treating doctors in this kidney clinic. May I confirm your name and age, please?
Yeah, I'm Asma. I'm 40 years old.
Nice to meet you, Miss Asma. Today I'm here to discuss about your medical condition. So may I know how do you want anyone to accompany you during the discussion?
Oh, no. I'm fine alone.
Yeah. So before we continue, how could you explain me how much you understand about your condition so far, so that we can be on the same page?
Yeah, doctor, I've been having multiple episodes of joint pain and also some rash, which actually get worse under the hot sun. And also I have a lot of this loss of my hair, especially when I go for shower, as well as weight loss. All these things already happened for almost 2 months now. And I have done some blood tests as well as a urine test. So today I was called to see the doctor in the kidney clinic.
Yeah. First of all, I'm really sorry to hear that you are quite but you are quite suffering these symptoms. Actually, your results are in my hand. May I know, do you have any idea about your condition?
I don't know, doctor.
Yeah.
All these
So
things have been very disturbing to me. I want to know what is wrong with my body.
yeah, I will explain it to you. The results are quite more serious than we expected. Actually, the results show there is some urine protein in your urine, and your kidney function is a little bit deranged, impaired.
Oh, what does that mean, doctor?
Yeah, I understand it must be quite difficult for you to understand at the moment. This means that you have the disease, what we call the SLE, systemic lupus erythematosus.
Oh,
Have you
what,
ever,
doctor?
yeah, have you ever heard of this before?
Not really.
Yeah, it is actually the condition in which the autoimmune condition in which your defense system is attacking your own body tissue, especially the kidneys, your skin, your joints, and some of the other organs like the lungs. In that case, in your case, it is affecting your kidneys and your joints, your skin. That is the what we have the your kidney function is impaired.
Oh, so you mean to say that this SLE is causing injury to my kidney? And
Yeah, you
how sure are you this is due to this SLE, doctor?
This is a really concern. We have done the kidney function test and the urine test. It shows that your kidney is impaired and some amount of protein in your urine. That's why the most likely in your case is due to this condition or SLE. But we need to do some more tests to confirm this your kidney function is impairment is due to this condition SLE.
Oh,
Uh,
doctor, this SLE, is it curable?
Actually, I'm afraid to say that it is not curable, but there are many treatment options available to control your symptoms and to prevent the progression of the disease.
Oh,
Uh,
how
yeah,
how can you do that, doctor?
so don't worry, you are in good hands now. So we will be on the every steps of the management. And now we are going to do is we need to do the procedure, what we call the biopsy, kidney biopsy.
Oh, what does biopsy mean, doctor?
Yeah, don't worry about the medical term. Sorry about the medical term. It is that we are taking the snip of the tissue from your kidney.
Mm-hmm.
We will examine it under the microscope, and so that we can see what treatment option is available for you. Treatment is most suitable for you, because there are many types of kidney impairment in SLE.
Okay.
So
And how you going to take a snip from my kidney?
yeah.
Do I need to do anything for that?
Yeah, I'm now going to explain this to you. Kidney biopsy, we will done in the procedure room, and then it will be done by the specialist, clinic specialist, combined with the radiologist, scan doctor. We will then, they have done many procedure before, specialized in that area. Usually before the procedure, we will do some blood tests and to make sure that you are blood thinning level, including the blood thinning level and other medication. We will review your medication list maybe if you are taking the blood thinning medication and other medication, we might need to adjust, and some medication we might need to stop. And also you need to you need to do fasting for at least 8 hours before the procedure. Means you shouldn't eat or drink before the procedure.
Okay.
Yeah, are you following me?
Yeah.
Yeah. And then on the day of the procedure, we will done the procedure in the biopsy script procedure room, and then we will give you the some damping agent. You need to lie on your dummy, and then we will give you some damping agent on your back, on the flank, and then we will.
Sorry,
We
doctor.
might
What is Frank?
actually it is the back.
Oh, okay. My back, you mean?
Your
Okay.
back, yeah, on the side of the back, and then we will give you some numbing agent to that area, and then we might also give you some medication to make you sleepy, to make you comfortable during the procedure throughout your blood channel in your arm, and then we will give you the we will make a small incision on your back, and then after that we will put a small needle, special needle to take the sample from your back.
Okay.
To the,
So
yeah.
you mean to say that you're just going to poke at the back of my part of my back to take the sample?
Yes, we need to insert a small needle, small
Oh.
specialized needle to take the sample.
That sounds very scary. Are you going to do anything to make sure that the location you poke is accurate?
Yeah, this is a really concern. We were then guided by the ultrasound. We can be guided by the ultrasound so that we can localize your kidney size and localization of the kidney. And then after the procedure, you will be monitored, and you will be monitored in the monitoring room, observation room, and then we will monitor your vital signs. And then after the few hours, you can go home.
Oh, okay. And you just going to
Uh,
monitor my vital sign to make sure I'm okay?
Yeah, we will need to monitor all your conditions to make sure that you are safe to go home.
Oh, okay. What is the side effect that I may encounter, doctor, after the
Yes,
procedure?
this is a good question. It is usually the same procedure, but like other side procedure, it might have some side effects, like the bleeding at the insertion site of the needle and the blood in the urine, and also the pain. Even if we give the painkiller, numbing agent, after another is the infection at the site of the needle insertion, but we were trying to minimize all the other side effects. Usually the side effects are rare, and we can also monitor you during the observation room. If you report any of the side effects, we can give you the immediate treatments.
I see. Doctor, if I refuse for this procedure, is there any alternative options? 2 minutes
Yeah,
left.
yes, this is a really concern. I understand it might be quite scary for you, but it is you are right to refuse the procedure. But it is the procedure is for your best interest, because the benefits outweigh the risk. And there may be another alternative, like that we can give the medication without taking the kidney biopsy. But if we know the stage of your kidney damage, we can give you more suitable treatment.
Okay. Does that mean that if I'm not agreeable for this procedure, you still can give me medication, right?
There is a possibility, but we need to discuss with the kidney specialist and the joint and bone specialist, what we call the rheumatologist, and discuss what treatment is suitable for you. But according to the guidelines and our protocols, before giving the treatment, it's better to perform the kidney biopsy. So that we can guide the best treatment for you. And also by doing the procedure, we can also exclude the other possible causes of kidney damage. As you are aware of that, you are worrying that you want to know if kidney damage is due to this condition SLE, right?
I see. Okay, doctor.
If you are you happy to do the procedure?
Yeah. I will think about it first, but I think mostly I will agree because it looks very scary to do or not to do, but without doing, I
Yeah.
will know what happened to my kidney.
Yeah.
I'm worried my kidney will go into a failure.
Uh, Yeah, that's a good. I can understand. It must be quite scary for you, and it must be very difficult for you to understand all the information. But if we treat if you early treatments, we can prevent the kidney damage.
Okay.
You are already aware of scared of that.
Okay, time's up. Okay. All right. Thank you, Dr.
Thank you.
Right? Yin Tu, Okay, so how do you think about your performance for this station?
I'm not sure. Actually, my language is a little bit difficult for you, I think.
Yeah, but I still can understand. I still can understand. It's just that some of the words may be a bit close to each other, so it's a bit difficult. But if you do it in India, I think you need to slow down a bit in terms of your pronunciation, because I know Indian also speak very fast, but their pronunciation are actually more accurate. So for yours, I think if you speak a bit slow, slightly slow,
Yeah.
then you'll become clear. Okay,
Yeah.
I think your language is not an issue. So how what are the difficulty you find in this scenario?
First of all, I would like to. I need to check. I think he is scary. She said she is scary of the needle, and she's scared of the procedure. I would like to ask you why she won't she's scared of the procedure.
You
What's
want
the
to,
reason? I want to explore more
yeah,
about
you
the
want to
reason.
explore the reason she is a bit scared. Okay, that's good. Another thing is that what I I I understand that you have mentioned a few side effects for this renal biopsy, right? So you mentioned about bleeding, infections, and then you also mentioned about injury to the kidney. Is there any side effect that is important that you must mention?
Allergic to the medication.
No, not about the medication. Side effect for the
Side
procedure,
effects.
the biopsy.
Hematuria. I have discussed.
Yeah. You mentioned bleeding, which is hematuria as well, or at the site or even the urine. Anything else?
I cannot recall.
Can you recall? No, I mean, this is something that you didn't mention. That's why I'm asking. So any form of this form of procedure,
Failure.
correct, failure. That means you got a biopsy that is not unable to yield a good result. So there is always a risk of uh failure of getting the biopsy and may need to repeat the procedure, you see. So regardless of what biopsy, it can be liver biopsy, can be kidney biopsy, can be brain biopsy, can be some form of other biopsy. So you always must talk about there is a chance, there's a small chance that the procedure may be unsuccessful and the tissue that we obtain may be suboptimal and we may need to repeat the procedure. But generally, it is not common. But this is something that you need to be aware. Okay, so you must mention about that. Second thing is after doing the kidney biopsy, observe with vital sign. Is that all that we observe other than the vital sign? What do you usually observe?
Kidney function.
No, we don't take the kidney function after the biopsy immediately, right? Anything that we observe
Bleeding.
other than vital sign.
Bleeding at the kidney biopsy site.
Yeah, but usually there won't be having any severe bleeding, no much of bruising or any hematoma. But you mentioned about hematuria. How you going to monitor that?
What about urine output check?
Yeah, so usually it's a protocol, regardless of which country or which center, there is always a protocol that you must collect at least 3 samples of urine after the procedure to make sure there's no hematuria. So most of the time, even a normal biopsy, most of the time the person may have a bit of hematuria. I mean, it's like a purplish kind of pinkish kind of color of urine initially. So, but this generally all the urine should be clear after the third sample. Cannot be like persistently pinkish and then become even redder. So this is another clue that we need to mention to the patient. So we will need to monitor you in terms of your vital sign. We also need to collect a few samples of your urine to make sure that you don't have any bleeding in your kidneys. Okay, so this is something that you need to counsel as well. And for this scenario, I understand that it's a bit tight because you need to explain a bit on SLE and possibility of lupus nephritis and also counsel kidney biopsy. But actually, it's doable for you if because you can be a bit long-winded in the sense of repeating the sentence again and again. But if you practice a bit more fluent, you will have enough time to actually ask a bit on the social history. Okay, that's important. Like I mentioned, for every scenario, try your best to at least ask a bit on the social history. May I know, as your job, do you have any issue in your life? Just two questions. Perhaps if you don't have any time, don't even ask about smoking or alcohol. Just two questions, because it's important for us to show that we are a caring doctor. Okay, all right. On top of that, I think your comm skill is okay. You're quite okay. Just that some of the words may be a bit sticky to each other, so you need to slow down just a bit. Okay. And in terms of the concern, I think you address most of the concern well. Your judgment is also okay. Actually, you can get full marks if the examiner is okay with your language. I think it shouldn't be a problem. Your only problem is you speak a bit fast. It's a bit unusual that I see Myanmar candidates speak so fast. Usually they will take a bit of time and then stack a bit. Yours one is the another spectrum in which you speak quite fast, and the examiner sometimes may have a bit of difficulty to get what you are saying. So you can just slow down a bit and then give some pause, and then only then you continue the next point. Okay. So in terms of this scenario, you can mention about SLA. I think you are well practiced. You know how to explain about autoimmune condition. Okay, the cause is not known, symptoms like that, complication can injure here and there, and the outlook usually varies from person to person. And the management is actually medication as well as uh, medication to control the symptom and to prevent disease progression. I think you mentioned all that very well. Okay, the only thing you didn't mention is perhaps the outlook, which I think
Okay.
yeah, but I think it's fine because your focus is not about SLE per se. Your focus is actually about kidney biopsy. So yes, you mentioned about the procedure insertion of needle to obtain a small sample of the tissue. You want to mention the tissue nip or nipping of the kidney is fine. And then the indication you also mentioned, because different types has different management, different treatment. And then if not done, it's difficult to choose which one to choose. And then you also mentioned that it will be done by the expert doctor. And then pre-procedure, you also mentioned that blood tests will be done and some medication may need to be withheld, like the blood thinners. I think you did very well on that. And I said you should also mention that it can be done in the daycare setting, as an outpatient setting as well. Okay. And the procedure, the area over your back, you need to lie. Yes, you can mention that you lie on your tummy, and then your area will be clean, and the local medication will be given to numb the area. And then you must mention about the ultrasound guided so that it doesn't sound so scary. Okay, you must mention that we will do a bedside scan over your kidneys. Once we identify the location very well, accurately, then we will put in a small needle slowly. And then this is something additional if you want to show examiner that you really know how the kidney biopsy is done. So you can mention about that. It's optional. Even if you don't mention, I don't think any examiner will fault you for that, because usually kidney biopsy the patient must be able to hold their breath. Meaning to say, all those tachypneic patients, like ABA or ACOPD, all those patients like not very stable, they're tachypneic, they cannot do this procedure because they must be able to hold their breath. Okay, so you can tell the patient that you will be asked to intermittently hold your breath during the procedure in order to obtain a good sample. And because of the failure or unsuccessful procedure, you will also mention that sometimes we may need to do a few attempts in order to obtain a good quality sample as well. And then post-procedure, observe the vital sign and also field sample. And if no issue, can discharge on the same day. And you also mentioned that the benefit overweight the complication. And the complication, you generally mention everything except the risk of failure that you need to mention. And precaution, you should also mention about precaution. If you develop any fever, any pain, and you're uncomfortable or passing of blood in the urine, you can come to hospital immediately. So you also manage to ask about consent. I think it's good. Okay. And then you also manage, but you didn't manage to summarize because you can see that actually this is not an easy scenario, because it is easy in the sense that a lot of things are quite straightforward to explain, but the difficult point lies at the time management. So you need to really manage your time well, and you need to be very, I think your initial part, you started very well. You're very concise. Just that the pace I feel is very fast. Perhaps you are worried that you have not enough time to counsel a lot on the kidney biopsy. That's why you are very fast. And kidney biopsy part, sometimes you don't have to mention everything that I mentioned. The point that I listed out is just for completeness. I mean, just for perfection or completeness. But most of the time, even if you can mention 80% of this is enough. But certain thing like failure of this procedure may need to repeat. This I think is quite important, quite crucial to mention. Okay, and then consent is another crucial point. Okay, so okay, with that I got no other comment. Do you have any question?
Yeah, not at the moment. Yes.
No question, yeah?
Yeah.
So all the best to you, huh? So
Thank you.
yeah, anyone else have any question? If not, we'll go to the last scenario. Perhaps we'll go to the last scenario, so New Year is coming. So
Oh yeah, one thing. Sorry.
no problem. Sure.
She's asking any other alternative without taking the biopsy.
Yeah, so this is a challenging question actually. So we can always mention that we should always do a biopsy before start you on treatment. But if you really insist not to do the procedure, don't straight away tell the patient that okay, we will start the patient and pre them lah. We see how it goes. We shouldn't do that because by guideline we cannot do that, right? So what the idea is very easy. So in order, sometimes we don't have to answer the question. We just need to tai chi to on. You know what is tai chi? Tai chi meaning to say we actually diverge to a person that can help you. Okay.
Mm.
So in this kind of scenario, if it's difficult, he or she refuse, you can always mention that I can understand that you are very worried for to proceed with this procedure. Don't be worried. We are all here to help you. If you're not keen to proceed with this procedure, I can get a second opinion. I can let my consultant to talk to you, and we will see how it goes. But generally, we really need to get a confirmation based on the tissue before we can decide the best treatment for you. Are you this? Okay, so this is how you diverge the question. Sometimes your idea is to address their concern. Okay, your idea is not to get the best answer for the patient, whether it's a correct or a wrong one.
Yeah.
So
Yeah.
the idea is just to address the concern that you can provide a further expertise. If it's something that beyond your level, you feel it's difficult to cope, so try to get other to help you. Okay,
Yeah.
so
Yeah.
this is another tips perhaps. Okay, to answer all these kind of difficult question. Okay.
Yeah. Yeah. Thank you.
Right. Okay. Most welcome. So last one, we'll go to Dr. Tan. Are you there?
Hi, doctor. Thank you so
Yeah.
much.
Thanks. Okay. So thank you for taking the last scenario. I hope you are still okay. Yeah. Still active.
Yeah.
Okay. All right. So we'll give you 4 minutes, and your time will start now. Okay, all right. Time's up. Dr. Tan,
Okay.
this is Madam Aini. Please start.
Okay, sure. Good evening. I'm Dr. Tan. I'm one of the doctor in this endocrine clinic. First of all, can I double check? Is this Miss Aini, 32 years old?
Yeah, I'm Aini.
Hi, Madam Aini. How are you feeling today? Would you like anyone else to come to this clinic together with you?
Yeah, I'm feeling good. I don't want anyone else. It's okay.
Sure. Madam Aini, I received a letter from your GP saying that your sugar control level hasn't been so well recently. So basically, today we will discuss regarding your sugar control. Would that be okay?
Yeah, doctor. Sure.
Yeah. First of all, can I double check what have you understand so far?
Yeah, doctor, my problem is actually I have diabetes since 13 years old and I'm really on insulin since young. I'm taking about 14 units 3 times per day and at night time I'm taking about 20 units. So when I visit my GP, every time my GP has been scolding me because my 3 month sugar control was not good. I don't know why, doctor. I really want to optimize my sugar, but at the same time, it's always not being controlled.
I see. It must be difficult for you, but do not worry. We are here with you. We will help you through, and hopefully, we can find some solution at the end of this consultation. Yeah.
Okay,
So,
sure.
yeah. First of all, can I double check with you? You mentioned that you are injecting the insulin,
Mm.
14 units daytime, 3 times a day, and then insulin, 20 units at night. So, can I ask where do you inject and do you inject it according to doctor advice?
Yeah, I usually inject around my tummy area, and I
Sure.
will I will I will I will change the site. The problem is that despite having about 19 years of diabetes, I sometimes still a bit scared of the needle. I worry that the needle will poke into I will self accidentally injure myself in the needle. So sometimes I really need my family members to help me inject. I cannot do it on my own.
I see, I see. So can I ask any like lumps and bumps around the injecting site around your tummy area?
Yeah, sometimes I tend to inject like 1 week I tend to inject over the right side and then left another 1 week I will tend to inject over the left side. Sometimes I notice that there's some swelling as well.
I see, I see. What about like, do you ever like miss any medications like of your insulin?
Yeah, I have to be honest as well. I'm
Mm-hmm.
I'm actually working as a clerk in my office. Sometimes I forgot to take my insulin injection because I didn't take the insulin cartridge with me when I go to work. So sometimes I only inject in the morning before I eat my breakfast. I miss the lunch one, and then night one is only after I come back from work.
I see. Uh, so far for the 14 units one, the daytime one, do you do you aware that this medications need to inject like 30 minutes before your meal?
Yeah, I will inject about half an hour, sometimes up to
Okay,
1 hour before I take my
I
meals.
see, I see. And you are following it so far?
Yes.
Okay, sure. And then can I also ask, do you change your needles often?
Actually, no. Usually I change only 2 days once.
I see. Any problems like why you didn't change it
Yeah,
often?
because I want to save cost, doctor. I'm actually financially a bit tight. I try
I
not to.
see. I see.
Yeah.
We are definitely going to help you. Yeah. Okay. So, you mentioned to me that you're working as a clerk and then you have financial issue. Yeah. So,
Mm.
can I ask you, uh, anyone at home can support you, like financially or like because you mentioned that you have financial problem.
Yeah, my I'm married. I have two
Mm-hmm.
children, but both of them are very small, still going
I
to
see.
school. And
I
my
see.
husband had got a stroke recently and cannot work. So I'm actually the sole breadwinner in the family.
I see. It must be very difficult for you. So, Madam Aini, so after this consultation, I'm going to write a letter to my social service in the hospital so that they can help you financially and see whether any other form of help that can offer to you. Yeah.
Mm.
And also, you mentioned to me earlier that you have some needle fears, and then you ask your family members help you to inject sometimes. And as now your husband is having some stroke, so anyone else in the family can help you?
Actually, no, no one.
I see. We are going to definitely look into this problem as well. I will inform my superiors to discuss regarding this, and then I'm going to inform my diabetic nurse as well. There are few solutions that we can discuss with you. I will usually we can sometimes we can offer insulin pumps to patients like you who have needle fears and then cannot inject accordingly, because sometimes you mentions to me that you miss your injection
Mm.
before lunch and I right, so
Yeah.
that the insulin pump basically is a device you can is a small device you can carry with you, and then there's a small needles that connect below your tummy area, so that you do not inject it like 4 times a day, which you have been doing it now. I'm going to discuss with my superior first. Then subsequently, if my superiors also agrees that you can use this insulin pump, I'm going to ask the diabetic nurse and the pharmacist to teach you how to use the insulin pump correctly. Yeah. So please do not worry about how to use it. We are going to guide you through. Okay.
Okay. Doctor,
Yeah.
do I need to check my sugar regularly?
Yes, definitely we would advise you to do so. Have you been doing it so far?
Actually,
Because,
no.
yeah.
Actually no.
Mhm.
But doctor, I've been injecting the same dose for many years now. I notice that sometimes I feel dizzy because I don't really check my sugar. I just give the same dose all the time. And then sometimes I
Sure.
feel after the jab, I feel very dizzy, and sometimes I do sweat a lot.
I see. From your symptoms, it's highly suggests that your sugar level can go down too low when after you inject, which we call it hypoglycemia. I'm not sure you have heard of this term
Yeah, yeah, I heard
previously.
about this. Yeah.
Yeah. So if the sugar go down too low in the body, it's not good for your health, and it can quite dangerous, as it can cause you to go dizziness and lost conscious, which we do not want it to happen as well. And just now I did hear you mentions that you have problems like changing the needles.
2 minutes
Um,
left.
yeah, sure. So do you have any problems like buying the sugar monitoring machine?
Yeah, I have.
Okay, so again, I'm going to inform the social service so that see whether they can help to provide some the sugar monitoring stick to you, so that we can monitor it very often. And then I'm going to highlight this to my superiors as well, because sometimes we can provide patients with a continuous sugar monitoring, which is a device placed on your arm area, so that we can monitor it closely.
Doctor,
Okay.
what will happen if my sugar still persistently high like this?
Okay, it can cause a lot of complication. So it can cause for you get higher risk to get some heart attack, stroke, and then it can damage your kidney as well, which is not good. So that's the reason we are here to help you, so that with good sugar control, we hope that all this complication can be avoided. Yeah, because you are still very young, and then your kids are still very small.
Doctor,
So yep.
I actually plan to get pregnant next year. Is there any issue if I get pregnant?
I see, Madam Ali, what I would advise you is I advise you to control your sugar better first, so that when your sugar control is better, uh, uh, that's the best time you get married. You get pregnant later, so that it's good for your health, and then it can provide good outcomes for your babies as well.
Okay, okay, doctor.
Okay. So any other concerns?
No, doctor.
No. So I'm going to provide you some pamphlet, and then after this, I'm going to ask my diabetic nurse and nurses to come to have a look at you, and then the dietitian team. Yeah. Thank you
Okay,
so much.
all right. Okay, thank you. Okay, Dr. Tan. So, how do you feel about this scenario?
I think I'm too slow because too many things to address. At the end, when I realize it's 2 minutes, then I think I speed up, but I think I scared I couldn't cover a big chunk of it, like complication, or I miss out concern. I think the time
But I think it's
management.
fine. I really think it's fine. It's just that the initial part, yes, I think you try to speak very clear and loud. I think that's very good. It's just that maybe just need to speed up just slightly, very, very slightly. Huh?
Okay,
Otherwise
sure.
it's almost perfect already. Huh? And actually the way when you counsel is good because you try to explore the issue of non-compliance, whether any issue of non-compliance, and what is the reason of the sugar is not being optimized despite injecting insulin, in which the injection site is also one of the issue. Needle phobia is another issue. Another thing is the hypoglycemia, frequent hypoglycemia. Okay, so I think you managed to get most of the point. Okay, so in terms of complication, I think you're a bit rushed because not much time, but generally you cover the important ones. Also, good that if you got more time, you can mention about the short-term complication and the long-term complication. Short-term is the one that sugar goes too high, can cause a lot of dehydration and can be life-threatening that require ICU admission, the DKA, right? And the chronic one, I mean the long-term one, don't mention chronic, mention the chronic, the long-term complication can include all those things that you mentioned. And then
Okay.
actually, even if the candidate didn't ask you regarding the pregnancy, this is a kind of scenario that you should offer by yourself because
I
you
see.
see that it's uncontrolled DM and she is also in the reproductive age group. So therefore, it's important for you to actually ask the question, do you have any chance that you are planning for any pregnancy later on? So you must go into this topic straight because this is another topic that because we know that HbA1c more than in fact, HbA1c more than 8% alone, it already carry a risk of pregnancy, be it from the maternal or from the baby aspect. So it's important that she definitely need optimization. Okay. And another thing is that the management, the non-pharmaco management, but you managed to mention a few. You mentioned dietitian, you mentioned about the eye checkup. Okay. So all those things are okay. So and again, because time is very rushed, you don't have time to ask about social history. Okay, social history, I expect everyone to ask probably just one or two questions at least, just to cover it. So sometimes if you didn't really have time to ask, it's fine. As long as you manage to cover most of the thing. Because this kind of scenario is less the focus is actually less on the social aspect or the empathy aspect. It's not like those emotional kind of scenario. This is a scenario that you are more on education per se. So you're educating the patient. So you try to refer to the welfare and then to get the insulin pump, the idea of insulin pump. But probably it's also good that you just mention in a brief instead of in too much details. You say that there is a possibility that we can get a device that can monitor the sugar at the same time, self giving the insulin into your body, to your system. That will be a bit more convenient for you. But I will get back to you after I discuss with my consultant, something like that. And how about the changing of the site? You didn't counsel the patient to change the site. Okay. So you must say that you have to change frequently, not every once a week like that. Another thing is the work issue because she have so-called frequent hypoglycemia and she didn't check her sugar. First, she needs to check her sugar and also need to know how to self-adjust the insulin. Second thing is the dose per se. So with this kind of work issue, difficult to inject 3 times per pre-meal and also night time. So you may actually consider switching to long-acting insulin, longer acting insulin later on. You can tell that to the patient so that in a way the examiner know that okay how you tackle this issue. Okay, but not now. Definitely you definitely need to optimize a bit more. Only then you slowly switch to the long acting regime. Okay.
Yeah.
So if you're going to mark you, actually you can get almost full marks. Okay. I think yeah, I think you can get full marks. No issue. It's just that your timing need to adjust a bit. At the same time, try to budget your question and your answer. I realize sometimes can be a bit too long. So
Okay.
it is try to make things simple, huh? Because if you're going to make the sentence very long and you repeat again and you confirm again, it is going to take a lot of time. You can confirm a few times, but when you speak, you have to be very concise, as simple as you can and as concise as you can. So that will actually give more time for you as well as the surrogate to ask question and for you to address the remaining concern. Okay. And this is like a long scenario, like I mentioned. You don't have to go all the points, but mainly this is the point of discussion that can happen for this kind of scenario. This scenario is actually a bit unfair. Needle phobia after 19 years of insulin is not fair. But I calibrate as such to actually tackle that what are the potential issue with insulin and poor control DM. So this is something that you need to think of. It can be needle phobia, can be because of the compliance of the dosing, and can be because sometimes patient injected didn't check the sugar, frequent hypo, and therefore they started to become non-compliant. They started to skip some doses. So that's also another possibility. So it's also another reason you need to explore whether this is the reason that she is not her sugar is not optimized. And then all the complication, generally you don't have to mention all. Just need to mention the main one. And the management, you also need to mention a bit on the non-pharmaco aspect. First, counsel the lifestyle modification, exercise weight reduction, as well as a referral dietitian for diabetic diet or diabetic educator in terms of counseling on the insulin injection and address the remaining issue. And if you got time, answers about the social support. I think you mentioned about the support initially. Yeah, you mentioned about who can inject the insulin for you. I think that's fine. You mentioned about the social support. Okay. So next is the ending part in which the summary and also some education and also the financial aid, the welfare group. I think you did very well. Okay. You got any question?
No from me. Thank you so much, doctor.
Thank you, Tan Tan. Anyone have any question before we call it a day? Yeah, I think everyone can't wait for me to mention about this. I think it's like a last day of the year and I'm occupying everyone time for this. Okay, so I hope everyone will learn something. We'll provide a recording because I know most of people have a lot of activities tonight, but don't be worried, we'll share the recording later. And the idea is to keep on practicing with different people because some people will have different tutors or different seniors, they will have some different ideas. It's also good to learn from everyone. And then if anyone have any question, can also text me or even post in the group directly so that we can learn together. Okay, with that,